In this WebMD webinar, Dr. Julia E. McGuinness explains the importance of tailoring breast cancer screenings to each individual. She emphasizes the need to understand your own risk factors and breast density in order to have a discussion with your doctor about the best way to screen for breast cancer. Dr. McGuinness, who specializes in caring for those with breast cancer and at high risk, provides valuable insights into the most recent screening guidelines. When it comes to breast cancer screenings, it can be confusing to figure out which option is the best for you. There are a variety of factors to consider when making this decision. In a recent poll, 46% of participants said they manage their breast cancer risk by discussing screening options with their doctor. Other important factors to consider include knowing your risk factors for breast cancer, being aware of your breast density, and taking into account your own personal screening preferences. These are all important aspects to consider when choosing the best breast cancer screening option for you. Breast cancer is the most common cancer in women, with about 1 in 8 women being diagnosed in their lifetimes, explains McGuinness. This is why screening is crucial, as the goal is to find cancer early. Breast cancer screenings can help find cancer before you experience any symptoms, increase the likelihood of a cure, lower the cost of treatment, and allow for treatments with fewer side effects. When it comes to breast cancer screenings, there are a few different options to consider. Screening mammograms. 3D mammograms or digital breast tomosynthesis. Breast ultrasound. Breast MRI. For most women, a mammogram every 1 to 2 years is recommended. However, if you are at high risk for breast cancer, such as having dense breast tissue, it may be necessary to consider additional imaging such as a breast ultrasound or breast MRI. It's important to have a discussion with your doctor about the best screening options for you based on your individual risk and medical history. Your own preferences also play a role in the decision-making process, as there is not just one recommended way to screen for breast cancer. When it comes to managing claustrophobia during mammograms, there are a few things to consider. For breast MRIs, which are longer exams, medications may be used to help with claustrophobia. On the other hand, for mammograms, which are shorter and more commonly done, anxiety medication may not be necessary for everyone. It's important to talk with the mammogram technicians or your doctor to understand the process and discuss any concerns you may have. Costochondritis, which is inflammation in the ribs or tissues next to the ribs, can cause chest pain, especially during movements or deep breaths. If you experience discomfort during a mammogram, it's important to inform your doctor and the technician so they can make adjustments for your next exam. For those with dense breasts who undergo yearly sonograms, mammograms are still necessary. While ultrasounds are not very effective at detecting breast cancer on their own, mammograms provide more accurate results. If you are at high risk of breast cancer but allergic to MRI contrast dyes, mammograms and ultrasounds are the recommended alternatives. CAT scans for breast screening may be an option in the future. For transgender individuals, there are no specific guidelines for breast cancer screening. However, it is generally recommended that individuals assigned female at birth continue with mammograms unless they have had bilateral mastectomies. It is also important for individuals who have had breast augmentation or reduction surgery to undergo annual mammograms. As for age-related considerations, the guidelines suggest that mammograms can be continued after the age of 75 for those who are healthy and living longer. However, the decision to stop screening mammograms should be discussed with your doctor based on your specific situation. While there is no direct link between osteoporosis and breast cancer risk, never having children or having a first child after the age of 30 are considered risk factors for breast cancer. It's important to consider these factors as part of the overall risk assessment for breast cancer screening. Remember to discuss any concerns or questions with your healthcare provider.